Dear colleagues, this is phacoemulsification of a hard cataract. Nuclear sclerosis in this case is about grade 4. I have taken up this case for surgery. Let us see the surgical steps. The main incision has been placed and now I am injecting an air bubble to stain the anterior capsule. I always stain the anterior capsule with trypan blue dye underneath an air bubble. If you use an air bubble, the dye is not diluted by aqueous and staining becomes immediate. So you save a lot of time. The dye is washed out, and since this is a hard cataract, in this case I am going to use Viscoat. Then underneath the Viscoat HPMC, you can say this is modified soft shell technique. This is Viscoat, and now here goes the 2% hydroxypropyl methyl cellulose injected just over the anterior capsule. What will happen is the Viscoat containing chondroitin sulfate, which is very good to protect the corneal endothelium, will go upward and stick to the corneal endothelium. Side ports are made. Now this is capsulorhexis. The anticapsule has been incised with a 26 gauge bent needle. Now I hold this capsular flap with a uterata forceps, go anticlockwise and do an adequate sized rhexis. In this case I didn't make a very large rhexis as I usually do in hard cataracts. I did a rhexis of about say 5.25 millimeter in diameter. Now hydrodissection. Hydrodissection is done with BSS. The fluid wave should go from one side to the other side. Now the nucleus is tapped and the nucleus is mobilized and the nucleus is rotated. In hard cataracts, we should do a nice hydrodissection so that the nucleus rotates nicely. Now here is what I say submarine chop. Bury the tip just in front of the main incision into the substance of the nucleus. Go through the nucleus just like a submarine travels through water, and as you cross beyond the center of the lens, just chop it. There are many advantages. You are at a deeper plane and you are sure that the nucleus will be divided into fragments, and this is the initial crack. Whenever there is an air bubble, use vacuum and remove that air bubble to get better visualization. So the nucleus has been divided into 4 fragments. Now each fragment is worked on with ultrasonic energy and it is removed. Phaco power used in this case is 80%. Flow rate is 45 ml per minute. Vacuum is 450 millimeter of mercury. The camera for recording this device, this surgery, is Sony Alpha 7S2. The microscope is Topcon OMS 800. And this is the last nuclear fragment. We must take extra precautions at this time because we should not catch the posterior capsule this time, and the antechamber should be very stable. There should not be any surge. Remove the chopper, emulsify single-handedly, go to 3, come back to 2, like that, very slowly emulsify this last bit of nucleus. You can decrease the parameters at this time. Inject some viscoelastic substance, and now is the time to clean the cortical matter. This is a 23G Simcoe cannula, and see how nicely you can remove the cortex with this very simple instrument. This is used in SICS, but this can be very well used in phacoemulsification. So the cortex is cleaned, and now a hydrophobic acrylic yellow intraocular lens from Orolab is being implanted in this case. No financial interest, just to tell you that I have deep reverence, very high regards for Dr. G. Venkatasamy, Professor G. Venkatasamy, founder of Arvind Eye Care System. He's a great man, and because of him, lakhs of surgeries, quality surgeries, are done in India in various Arvind Eye Care hospitals. This is a beautiful lens from Orolab. See the clarity of this lens. And now the side ports are hydrated, and a final lavage of the anterior chamber is done, and see what happens. Whatever viscoelastic substance was sticking to the corneal endothelium comes out when I irrigate towards the corneal endothelium. The antechamber is formed and the case is concluded. Thank you very much for watching. Hope this video will help you in developing your surgical skills. Be better and do better. Thank you very much.